Hello, this is Justin Vaughn with Miramed Global Services, bringing you another article of import to the healthcare industry. Today's article is entitled, "Is Your Data Secure? Healthcare Devices Come Under Scrutiny." Let's begin. Yes, we live in that world now. It's a world where techno-wizardry abounds. It's a place of unparalleled digital progress. But with that progress comes unprecedented dependence. Dependence upon software and digital networks and electronic devices. It is the very nature of this dependence that presents the inherent dangers that we now see cropping up all around us. In that sense, no one is safe. The American military is a good example of this. Because it relies so heavily on digital technology, it must devote enormous budgetary resources to defending these capabilities from potential cyber attacks. Like it or not, this is the world we have decided to build. And because of that, nations and organizations and individuals must be on guard against the relentless threat of the hacker. This section is entitled Device Vulnerability. The U.S. Department of Homeland Security's Cybersecurity and Infrastructure Security Agency, or CISA, announced late this January that they have detected 6 vulnerabilities in GE healthcare devices. If exploited, these vulnerabilities could allow bad actors to effectively make these medical devices unusable, or at the very least, their functionality could be severely compromised. According to CISA, the affected GE devices are connected with the GE Healthcare Clinical Information Central Stations and Telemetry Servers, including the CareScape Central Information Center, Apex Telemetry Server/Tower, Central Station, Telemetry Servicer B450, Patient Monitor, B650, Patient Monitor, and B850, Patient Monitor. If the weak spots in the GE health devices are ultimately exploited, hackers might be able to make changes in the device's software that would interfere with the device's functionality, make changes to alarm settings, and expose protected health information, or PHI. Any of these scenarios are potentially deleterious to patients from both a medical and privacy perspective. This section is entitled Discovery of Vulnerability. The vulnerabilities of GE's health devices were actually discovered by a third-party cybersecurity company, CyberMDX. Based on the National Infrastructure Advisory Council's scoring methodology for assessing the severity of computer vulnerabilities, CyberMDX rated the GE device vulnerabilities, giving each a numeric score. It was determined in their review of the GE devices that 5 of the 6 vulnerabilities received a severity score of 10. The remaining vulnerability was given an 8.5 severity score. It is worth mentioning that this is only one catch by one company. There is no telling how many other health-related devices are innately vulnerable to hacking that have not been uncovered by the good guys. And there is no telling how many of these devices are already being targeted by the bad guys. This section is entitled Scope and Solutions. According to Becker's Hospital Review, the number of healthcare devices similarly affected is largely unknown. And this uncertainty exists on a global scale. Based on CyberMDX's calculations, literally hundreds of thousands of devices may be at risk. As to the GE vulnerabilities already identified, The Food and Drug Administration, or FDA, has recommended hospitals segregate any networks connecting to the patient monitors. In addition, they should be using firewalls, virtual private networks, network monitors, or other technologies to mitigate the risk of the GE vulnerabilities being exploited. When it comes to other potential defects in medical device security, health organizations would do well to be proactive in beefing up security to the extent practicable. They may want to hire cybersecurity experts to perform a review of risk areas and make recommendations. They should also keep abreast of official notifications by CISA, the FDA, and other agencies regarding newly discovered deficiencies in medical devices that might compromise patient safety or privacy. It is important to note that the FDA's cybersecurity webpage contains the following admonition. Medical device manufacturers, or MDMs, are responsible for remaining vigilant about identifying risks and hazards associated with their medical devices, including risks related to cybersecurity. Healthcare delivery organizations, or HDOs, should evaluate their network security and protect their hospital systems. Both MDMs and HDOs are responsible for putting appropriate mitigations in place to address patient safety risks and ensure proper device performance. So, having read that admonition, this obviously means that whether or not the medical device firm is doing its job in ensuring sufficient defense against potential hackers, the hospital must. It must do this job. It is no longer an option, but an obligation. In fact, cyber defense is something we are all going to have to take very seriously and work continually to address. It is the world we now live in. If you would like more information on how to assess and address medical device security, please contact us at www.miramedgs.com. Thank you for listening.